Hi everyone, this is Lynn with the State of Utah HMIS team, and this video is going to go over how to use services and the notification feature to effectively track both doses of the Moderna and Pfizer COVID-19 vaccines. Our hope is that this will help you ensure that the clients that you are serving receive both vaccinations and have the benefit of both of them. So I'm just going to log into our training database here. You'll be able to do this in our live database. You can do this now. And I am just logged in under our sample organization. So this is this is a dummy client. And I created a couple of enrollments for this client. So this client is based in Salt Lake County, just based on the enrollments that I picked. And they have a coordinated entry enrollment, and they have an open emergency shelter enrollment in the downtown Salt Lake City area. This person, we're going to imagine they have received the Moderna vaccine. And so there's two places that you should record this, as long as the client has given permission to share this information globally. Not globally, but globally in HMIS, so all providers can see it. So you would want to double check with this client before entering this. But as long as they're okay with this information being shared, you can put this into the system. If they want to share it, but only within your agency, then you can do that as well. If they don't want it shared, this is not a required HUD data element. It is really only meant to leverage the system to help make sure that they can get both of their vaccinations, and we can have an idea of if a person is vaccinated or not. Also, to make it really clear, no housing eligibility should be dependent on if a person is vaccinated or not. There shouldn't be any eligibility requirements that hinge on this. This is merely for tracking and to help those clients that we serve with this way. So what you will do to add the service is you'll just add a service just like you do any other way. If a client like this one has more than one enrollment open, we ask that you add them in the coordinated entry enrollment. If they have more than one open and one is not a coordinated entry enrollment, that's okay. Use the one that you typically use to record your case management services. But if they have an open coordinated entry enrollment, record it there. So that's where we're going to do it. I'm just going to use this action button. I'm going to select services. I'm just going to select add new. We're going to select the service that they received. So we have added several services into the system. And if there are additional vaccines that are approved, then we will add additional services to reflect those. Right now we have the Moderna and the Pfizer vaccine. We'll just pretend that this client received the first dose of Moderna, so we're going to track Moderna dose 1. There's an information box here that actually gives you a little bit of help text. For these services, we would like you to add some additional information into the system, just so you can track it a little bit more. There's just not quite enough here to track everything you need to track for these vaccines. You'll record this for the date that they received the vaccine. So if it was a couple of days ago, you'd put it there. I'm just going to keep it for 2/2 because that's when I opened my enrollment. But you'll just put it in for that date. And then in the comment box, you'll add your comment. And again, the help text is right there. And I have mine saved somewhere. There it is. And if you didn't know, you can actually make this box a little bigger so you can see it. So I just wrote in, they received it at the 4th Street Mobile Medical Clinic in Salt Lake. Again, we're pretending this client is based in Salt Lake County. And then their follow-up is scheduled for 10 a.m. on 2/23/21 at 4th Street Clinic. This will allow any user who can see this service to know when their follow-up is so they can follow up with that client as well. So if it's not you in the next 3 weeks, then the next person working with this client can help them in that way. So we'll add it here. And putting in the service also allows us to pull some analytics on the back end. We'll be able to say this many people received the Moderna vaccine, this many people received vaccines in general. So we'll be able to get an idea of how many of the people we are serving have been vaccinated, which, if this is tracked well, would be really cool down the line. The other thing you should do is add a notification in here. And what that will allow you to do is you'll be able to see this notification up here. You'll get a little one up here, because services can get buried really easily. So if this client is staying in that emergency shelter every night, they're receiving an emergency shelter service every day. They may be receiving other services. That service is probably going to get buried pretty quickly. So that's why we ask you also create a notification so that you can see. So you just click on the notification bell here. You click on add notification, and your message is going to be the same message for their first vaccine. So I just pasted this again, so let me come back to the beginning of it. It's a little hard to see. The message is received at 4th Street Mobile Medical. We'll say so Moderna first COVID-19 vaccine dose received at 4th Street Mobile Medical Clinic in Salt Lake. Follow-up is scheduled for 10 a.m. on 2/23/21 at 4th Street Clinic. This can be left as information. Your priority can be high, medium, or low. I would mark this as high because they have a pending follow-up, and it's a very strict deadline with these vaccines, so we want to make sure that they are seen. Your start date is the day they receive the vaccine again. So again, if it was a couple of days ago, you would backdate this. And their status would be new or pending. That way, when you go to this client's page, you will see it. You don't need to change anything else here. If the client has chosen to share their information with just the organization and not the entire system, then you would change this. But as long as they're okay with their information, this vaccine information being shared across the system, then you can leave it as its default. So now we have a notification. So when you come to the client dashboard, it's always good practice to just double check if they have a notification. Just double check what it is. Most of the time, it's not really going to pertain to you, but sometimes there is some really pertinent information in there. So it's really good to double check it. So you'll see this, they have their notification there. The full notification is there. It's not cut off, so it's easier to see. So let's pretend it is now 2/23. It's been 3 weeks. They are due for their second vaccine. They were able to get it. And so now we would want to record that as well. And this process is exactly the same. You'll record the service. And I'll just add this Moderna service here. Only the service changes because now it's the second dose. Your help text also changes a little bit. You no longer have to put in the follow-up information in that comment box. So you will just put in, I'm just going to tweak what I have in my clipboard here. You can put in received at 4th Street Mobile Medical in Salt Lake. And then you would make sure that date is the day they received that dose. So we're pretending we're in the future. So we'll hit save. And again, you would change this if they chose only to share it within the organization. But most people do share it globally. So there you have your record of both your doses there. And if this is a coordinated entry enrollment, there may be other services here. In your other projects, there may be other services here. That's fine. There's both of their doses. You would also update their notification. So you can edit this notification. You can mark the day it was complete. You'll remember this is that first dose notification. So we'll just say this is complete and hit save. This can only be edited by the agency that created it. So if you're seeing one from another agency, they will need to edit it. So keep that in mind. And then you can add another notification to identify that they have received the second dose. You need to add just a little bit more detail to this because it doesn't tell you what the notification is. So I just had something in my clipboard here. So received second Moderna COVID-19 dose on And this is just an example. We just want it to be descriptive so that somebody else coming back to it would know. Correct my spelling there. And again, this is just information. You can set the priority. You would set your date. I'm going to leave this date on today so that you'll see it in the system when I hit save. But you could adjust it. It should be the day that they actually received the dose. And now you can see there's that second Moderna dose there. Since we're looking at notifications, I've already had you here for 10 minutes. I just want to show you. There's a notification history. Oh, there. It's under Edit Client Notifications. You can see a history of all of their notifications there. So you can see them all. That's all I have for you today. Please reach out to our team if you have questions. You may email us at hmis@utah.gov, and we're always happy to help. Thank you.